Welcome to this pediatric anesthesia module, as what I call the pearls and the pitfalls. My name is Julie Lowry, and I'm a CRNA at the University of North Carolina at Chapel Hill, and I've been practicing as a CRNA for over 14 years. One thing that I've come to realize is that many of us don't necessarily like to engage in pediatric anesthesia. We can't think of anything worse, so to speak. And when we find ourselves having to anesthetize children, well, we kind of have to dig out the textbook or dust off the cobwebs and try to retrieve what we once learned and we once knew. And so this lecture is going to be really good for those of you that find yourself anesthetizing children on somewhat of a rare or non-occasional basis. And for those of you that do engage in pediatric anesthesia quite frequently, well, it may be a good review for you as well. Another facet of pediatric anesthesia, which can sometimes make us grumble, is the pediatric setup. It just doesn't tend to be as routine as it is to set up for an adult anesthetic. Think about it. You can throw together what you need for an adult anesthetic pretty quickly because everything is the same. Same size cables, same size monitor, same size blood pressure cuff, usually. Some would advocate using a 7.5 endotracheal tube in all adults, be it a man, be it a woman. Usually the same size laryngoscope blade. And even boiling it down to our drug dosages and the amount of drug that we drop in our syringes, pretty much the same across the board. The fudge factor is much more wide in adults, but not so in children. We have to take into account the age of the child. Another question that's circulating around the world of pediatric anesthesia lately is this. Is it okay to use cuff endotracheal tubes in pediatric patients, or should we continue to advocate the philosophy that uncuffed tubes are best? Well, from a historical aspect, the use of cuffed endotracheal tubes in children was somewhat forbidden, and I remember quite distinctly back when I was a nurse anesthesia student several years ago that one would never ever consider using a cuffed endotracheal tube in a child for their general anesthetic. To view the world or even this type of event as a child would see it. We might think that the surgical procedure that this child is about to undergo, very simple, kind of what's the big deal, so to speak. Why is this child so upset and agitated? But we have to realize that any event, even a minor event, is a huge event in the eyes of a child. I wish you the very best of luck, and I hope you have enjoyed this pediatric educational module.